evening, we've got a very special guest speaker, Cal Marcoux, and he's going to talk about his experiences navigating the Ontario healthcare system as a patient with primary immunodeficiency. Cal will also share some tools with us that have helped him along in this process. So, as a quick introduction, I'm going to read his bio. So Cal's a retired information security professional with 25 years of experience in compliance, risk management, privacy, and security of health information. Working in the health industry provided Cal with a foundational understanding of how Canada's healthcare systems work, knowledge that would serve him well as he took on the role of advocate and then caregiver, helping loved ones navigate their healthcare journeys. By the time he received his diagnosis of common variable immunodeficiency in 2022, he had already developed the foundations of a playbook for how to take charge of one's health and healthcare. And he continues to learn more with each new encounter. So next, I would like to welcome Cal.
Super. Thank you very much, Fiona. So I'll just share I've got a brief presentation, and then I'll share the tool that I use for keeping track of all of my records. So again,
Great.
Thank you, Fiona, for that introduction, and thank you for inviting me. I'm glad to be here, and hopefully we'll have some shared experiences. So just very briefly, I think Fiona touched on a lot of this stuff. I worked in the health industry for 25 years plus, and not in patient care, but my involvement in the industry did give me a foundational understanding of how the healthcare system worked. I spent time, and I'm continuing to spend time being an advocate for my parents as they're aging and their healthcare needs are becoming more complex, and they're needing more and more assistance navigating their own journeys through the system. In 2020, my partner was diagnosed with a serious illness, so I was thrown into the role of caregiver. And that involved, as you can imagine, managing a whole bunch of treatments, monitoring health vitals, giving medications, juggling multiple tests and procedures every week, labs, everything else. So all of those experiences really gave me an appreciation and an understanding of how complex and sometimes difficult it is to navigate one's way through the healthcare system. And it really struck me that the challenge I was having could be really it really came down to the fact that I didn't feel like I was always in control. I felt like I was along for the ride on this crazy train that's just barreling through. So by the time I was diagnosed with CVID in early 2022, I had already developed a number of tools and some habits and a foundational system for record keeping. And that's what we're going to speak about today. Very briefly, we know that better patient experiences do lead to better health outcomes. That's a known fact. And if we have a better experience, we'll probably have better overall quality of life too. So remember, this is our journey. Each of us, this is our own journey, and we know what we need, and we need to take charge. Having a chronic or rare condition does come with myriad challenges, as you're all probably very aware. And I imagine that many of you have been in the situation that I found myself in a couple of times, where you find yourself in a walk-in clinic or in an emergency room or at a new specialist, and it dawns on you fairly quickly that out of all the people in the room, you're the one who's the expert in your particular special magical condition. So that's the reality of folks with a rare disease or even a chronic disease. The challenge, the number of interactions we have with the healthcare system, many different providers, having to repeat your story multiple times. The fact that the disease manifests uniquely for each of us, so we can't make any assumptions, and nor can the medical professionals. as we know, not all medical providers have knowledge of those of our conditions. So again, all of those challenges contribute to that sense of I need to feel like I need to take charge of those things that I can control because there's an awful lot of them that I can't. So how do we do that? How do we take charge? Well, first and foremost, we need to learn as much as we can about our condition. There's lots of good sources of information on the web. National Institutes of Health, Immunity Canada, Immune Deficiency Foundation, just three examples. With the, the caveat that there's a lot of bad information on the web too. But, we can learn from each other in forums like these. We can learn from doing our own research and, that it's important because like we all know, we're going to be the expert in the room sometimes. The second thing that we can do is really set out our expectations with our healthcare providers. Speak up, ask questions. So every single time that I go to a doctor's appointment or any kind of medical appointment, I have notes in front of me, and those notes are my list of questions or the things that I want to bring up to that particular provider for that appointment. I also take notes during the appointment, and I ask for copies of anything that I can't already get access to. So I ask for copies of test results, for the letters that physicians send back and forth to each other after you have your visit with the specialist. I get copies of all of those things for my own records. And I think it's important that we all take advantage of online patient portals where a lot of that electronic health information is available for us. You're more likely to get access to those at larger healthcare centers or larger clinics or at teaching hospitals. So if you're lucky enough to live close to a teaching hospital, if you can get yourself to the specialist at that teaching hospital, that won't hurt. And just a few stats from the Canadian Institute for Health Information, where I used to work. 38% of patients in Ontario access their health information online. 39% of Canadians broadly access their health information electronically. Saskatchewan is leading the charge with 60% of patients, and Manitoba is bringing up the rear with 14% of patients accessing their medical information electronically. So there's still not a lot of uptake, but it's really helpful if you can. Very quickly, this is just a book that I found that, although it doesn't address primary immunodeficiency diseases, it does give a very good explanation of how the immune system works. It's a fairly hefty book. It's written in very simple language. A young person could understand it. And it's very comprehensive, and I found it very helpful. So if you're interested in learning about all those parts of your immune system and what they are and how they work together, this is the book for you. So, once you've developed that more assertive approach with your providers, where you're making your requests and demands and expectations known, where you're gathering up all of this information so that you can organize it and you can have an understanding of what's happening. You need to find a way of organizing it for yourself. And you need to keep your own personal health record or a journal. So some of the things listed there, providers, encounters, vitals, etc. Those are the things that I think are important that I need to track for my own journey. Your list might be different. And your personal health record might be paper, it might be electronic, it might be a binder, it might be a shoebox with a bunch of, printed off pieces of paper in it, whatever works for you. Mine is, I use Excel, and I've, over the years, developed a fairly comprehensive Excel worksheet, which I will share with you now. So this is my Excel spreadsheet that I use to help me keep track of everything that's happening with my health. And feel free to mock me for a bit of OCD and with the, how comprehensive it is. So this is the index, and you'll see that there are a number of different worksheets within the workbook down here. So if we go to the first worksheet, providers, I keep trying, none of this information, this has all been anonymized, as you can see, because Rock Hudson and Angelina Jolie are not my healthcare providers in reality. But I keep track of all of my providers, what their specialty is, contact information for them in the clinic, website, emails, etc. I keep track of encounters with those healthcare providers. So every time that I see one of my healthcare providers, I will record it here, the date and time, who the provider was. And this list of providers is actually a drop down, which refers back to that previous sheet. So if I add a new provider on this worksheet, it will automatically show up in this drop down list. Why did I see that person? And any notes I want to take. This column here, documents, you'll see on many of my the tables that I track here. And what that tells me is I've got a document in a special folder on my laptop that is more information about this particular visit. So if I had blood work at Life Labs, I will have a printed copy or a PDF version of that result there, and I keep it in a special folder. So I know where I've got to go look for more information. For those of us on subcutaneous immunoglobulin or IVIG, we're told we're supposed to keep a log. This is my log. I keep it here. And again, it's just the date, the lot number, any symptoms noted, and any notes that I want to take. I also keep track of my infusion supplies because I need to know when it's time to reorder, and I don't want to have to go rummaging through my cupboard every time to find out how many of each of my supplies I have left. I keep track of prescriptions. So again, the date, the prescription number, what is it, what has been prescribed for me, the pharmacy, the provider, all the information about refills and quantities and doses and frequencies. Whoops. And again, whether or not there's an additional document. My vitals and flow sheet. So, for me, I like to keep track of my heart rate, my blood pressure, systolic and diastolic, my oxygen saturation, my temperature, my weight and height, and pulmonary function test results. And so I have those maintained on this table. And what this allows me to do is to spot trends. I think it's important that, if my weight is going down or going up, or my pulmonary function tests are changing over time, I will spot it even if the doctor doesn't spot it. And then I'll be able to ask my doctor about it at the next visit. So I think it's important for me, at least, to sort of keep track of these things. Any tests or procedures I have done, so CTs, X-rays, if I have minor surgeries, things like that, I track it here. And again, usually there's documentation associated with that. Episodes and events, many of us get frequent, upper respiratory tract infections, and our doctors always ask us how many infections we've had since the last visit. So I keep track of things like that. Any sort of medical event or episode that I think might be important to take note of. I transcribe all my blood work into this sheet. Again, not because I don't have access in other ways, in separate reports for each of the tests that I've had, but this again allows me to spot trends very easily. So the small amount of time it takes each time I have blood work to enter these numbers, I feel more comfortable because I'll be able to see what's happening over a period of time. And then finally, at the end, immunizations. So, it's just something that we should keep track of. And in Ontario, unfortunately, we don't have a central repository where we can keep track of all our immunizations. So I keep track of it myself. So that's my that's the tool that I use. I'm happy to share it if anybody's interested. Um, so today, just briefly to recap, I talked about my personal experiences with the healthcare system and uh, what struck me as the need to find a way to manage my journey better, to have a sense of control over what was happening. Uh, some of the ways that I achieved that, and uh, one important tool is that personal health record. So there you have it.
So,
Thank you, Cal.
so there's a couple questions, Cal, one of which I can list out. Here I see, can you give me an example about when you used the tool with a health professional and did it lead to a positive outcome?
Yeah, so with my GP, for example, I bring in my iPad and I have that iPad in front of me, and he's always craning his neck and watching, and he asked me, "Oh, can you print out that record of your weights and blood pressures, and I'll throw it in your chart so I have it." Or uh, so he actually appreciates it and he uses it to help give him a more complete picture of my particular situation.
Do you ever feel like some of those symptoms, because they're all sort of uniquely manifested, you you share symptoms with a specialist that may not be something that they actually specialize in, but it could contribute to a better, yeah, scenario or better discussion?
Absolutely. Well, similar to that, I think my most common experience is with specialists. Uh, if you mention something that's outside of their particular specialty, often they're just not interested,
Yeah.
even though we
Mm-hmm.
know that all of those symptoms of various systems in our bodies, whether it's our livers and our lungs and our GI system or our skin or our respiratory tract, they're all related in some way sometimes because of our condition. But the specialties, they tend to, when you have a hammer, everything's a nail. So they tend to be fairly narrowly focused. And so I've found myself reminding them that as a result of my CVID, sometimes these things are not directly related, but related to the CVID and should be taken as a whole. And I'm lucky that my GP has played a big role in that too. I've got myself a really good GP. Uh, I've told him that he's not allowed to retire until after I'm gone. But he's been very helpful in managing that as well.
It's really helpful. Thanks, Cal. One other question. Do you share, and then I might pass it back to Fiona for a couple more. Do you share this file with anybody in your family or any particular close friends? Do you find that that's helpful in case you need an advocate one day on your behalf?
I don't share it now, but in my power of attorney for personal care, I've I've appended a document to that which points to this as my health record, the source of truth for my health records. So if I'm ever in this situation where my power of attorney needs to be executed and somebody else is managing my care, they will know because this has been referenced and they've been told how to find it.
Thank you.
I had the benefit of hearing your earlier presentation at the Ontario meeting, and I'm partly jealous, wanting to maybe incorporate some of this good record keeping, but maybe a little bit intimidated that I could not maintain the level there. So I'm wondering, do you have sort of a template that you're willing to share with the group, obviously anonymized or something?
Yeah, I'm happy to share that example that I walked through today. And the tables are all set up and you can, easily modify them to be more relevant for your own situation and what you deem important. Um, but yeah, I'm happy to share that. And I think we'll coordinate that through Fiona.
Okay.
Is that correct, Fiona?
Yes. Yes.
And maybe just one off the wall sort of question here. I'm getting into a lot of the AI stuff and that. How do you see that starting to work into this? Because I can tell you have a high-end cybersecurity type of background, but I can see immense potential for it in the future, but huge privacy risks.
Yeah, huge privacy risks. There are every jurisdiction, as you might know, in Canada has some kind of privacy legislation specific to health. Many of them specific to health information. AI, I mean, in my opinion, AI is on one hand overhyped, but on the other hand is going to radically change some industries. And I think healthcare is going to be one of them that's going to be radically changed. Just from a diagnostic perspective, uh, AI can be trained up to review, and it's being used now, like with mammograms, for example, where AI can be more effective at spotting early cancers than a human can in some instances, as far as as far as I've read. So I think it's going to be amazing what can be done with AI, and I'm hoping that from a diagnostics perspective, if we ever get a patient registry off the ground, um, setting an AI engine loose on the data of hundreds or thousands of different patients with primary immune deficiency diseases will, it may just enlighten us a little bit, and it may find things that the researchers haven't yet discovered.
So there's some exciting potential in the future for it.
I think so, yeah.
One other question. I know in some jurisdictions, I think it's a patchwork across the country, but in some jurisdictions, I believe people with their blood plasma product have to manually enter the unique barcode or whatever that's on there. And in other jurisdictions, apparently they're using something from the hematology or from blood disorder group using one of their apps so that you can just automatically scan in the information and not have to manually enter. Because I go, you're a technical wizard, but you're also doing a lot of manual entry there that, I could see with a few adoptions of different technology could sure make it a lot easier.
Absolutely. I mean, I would love to see this spreadsheet turned into an app. Somebody brought that up at the presentation at the Ontario meeting. Um, I just, it's, I started out in application development, but that was back in the days of the dinosaur. So I don't have the current skill set required to do so. But if I could find a youngster willing to work on this, I will. And as far as the recording of our SCIG log, Hyzentra, if you're on Hyzentra actually has an app in the various app stores that allows you to scan using your phone the barcode on the Hyzentra vials or the Hyzentra prefilled syringes. I used it for a while. I stopped using it because I forget what it was exactly, but there was something I found a bit clunky with it, and it was just as easy and no more time consuming for me to just track it myself anyway and use the stickers in a logbook, with the lot numbers. But there is an app certainly for Hyzentra, and I don't know if any of the other products have it or not.
Thank you very much for that, Cal. I really appreciate it.
Thank you.
I've got one last question, and I'm really interested in kind of what prompted you to start and create this spreadsheet. So I'm going to ask you, Cal, can you tell us about like a personal encounter you had in the healthcare system when you realized you needed this kind of tool to help you? Was there anything particular that sparred it?
I don't know that there was one event or one situation I found myself in. I think it was the culmination of, uh, you know, when I started sort of helping my parents with their journey through the health system, I used to just and they're in Windsor and I'm in Toronto. So I would, travel down to Windsor and accompany them to doctor's appointments and whatnot. And I had all these scraps of paper with my notes written on them, and then I just transcribed it all into a Word document, and I keep that Word document for them to this day. Uh, and then over time, with my partner, I found that there was just overwhelming amounts of information that I needed to keep track of, and I did need to because there were just too many moving parts in that healthcare journey. So this came together over a period of time. It started out much more simple than it is today, and sort of became a little more comprehensive as my needs changed and as I realized I could, continue to add things.
Thank you. That sounds like definitely answered my question. Are there any more questions before we finish? Okay, I want to thank you once again, Cal, and I'm sure we're all giving you a virtual round of applause.